Hello and welcome. Today we're diving into a fascinating, yet often distressing, condition affecting male fertility: Sertoli cell-only syndrome, also known as germ cell aplasia. We'll explore what this condition is, what causes it, how it's diagnosed, and what options are available for management. Let's get started. So, what exactly causes Sertoli cell-only syndrome? The causes are complex and often multifactorial, meaning a combination of things can contribute. Genetic factors play a significant role. Certain mutations on the Y chromosome, specifically in genes responsible for spermatogenesis, can be implicated. Environmental exposures are also suspected. Exposure to toxins, radiation, chemotherapy, or even certain pesticides during critical periods of testicular development can disrupt germ cell development. Sometimes, hormonal imbalances, such as elevated levels of follicle-stimulating hormone, can contribute. In many cases, however, the exact cause remains unknown, making it idiopathic. Let's talk about the pathophysiology, or how this condition actually works inside the body. In a healthy testis, both Sertoli cells and germ cells work in harmony. Germ cells, through a process called spermatogenesis, mature into sperm. Sertoli cells, often referred to as nurse cells, are vital for this process. They provide structural and nutritional support to the developing germ cells, regulate hormonal signals, and form the blood-testis barrier, protecting the developing sperm from the immune system. In Sertoli cell-only syndrome, the germ cells are absent or severely reduced. This leaves only Sertoli cells lining the seminiferous tubules, the structures where sperm production normally occurs. Without germ cells to nurture and support, the Sertoli cells are unable to perform their intended function of fostering sperm production, ultimately leading to infertility. Now let's consider the epidemiology. Sertoli cell-only syndrome is a relatively rare cause of male infertility. Accurately determining its prevalence is challenging, as many men may be unaware they have the condition until they attempt to conceive and undergo fertility testing. It's estimated to account for a small percentage, perhaps 1/10%, of cases of azoospermia, which is the absence of sperm in the ejaculate. The condition can be found in men of all ages and ethnicities, with no specific demographic particularly predisposed. What are the signs and symptoms? The primary and often the only symptom of Sertoli cell-only syndrome is infertility. Men with this condition are unable to conceive naturally due to the absence of sperm in their ejaculate. Other than infertility, there are typically no other noticeable physical symptoms. Men with Sertoli cell-only syndrome generally have normal secondary sexual characteristics, such as a deep voice, facial hair, and muscle mass, because their testosterone levels are usually within the normal range. They may, however, experience psychological distress related to their infertility. Diagnosis typically involves a combination of clinical evaluation, hormone testing, and testicular biopsy. The first step is often a semen analysis, which reveals azoospermia, the absence of sperm. Hormone testing, particularly of follicle-stimulating hormone FSH, often shows elevated levels. SA is produced by the pituitary gland and stimulates sperm production. When the tests aren't producing sperm, FSH levels tend to rise. However, the definitive diagnosis requires a testicular biopsy. A small sample of testicular tissue is examined under a microscope. In Sertoli cell-only syndrome, the biopsy reveals seminiferous tubules lined only with Sertoli cells, with a complete or near-complete absence of germ cells. While there aren't distinct classifications or types of Sertoli cell-only syndrome in the traditional sense, it's sometimes categorized based on the extent of germ cell absence. Some men may have a complete absence of germ cells in all tubules examined, while others may have a few isolated germ cells in a limited number of tubules. This distinction can sometimes be important when considering potential fertility treatment options. Unfortunately, there is no cure for Sertoli cell-only syndrome. Treatment focuses on managing the consequences of infertility and exploring options for achieving pregnancy. Hormone therapy is generally not effective in stimulating sperm production in these cases. The primary option for men who wish to have children is assisted reproductive technology, specifically using donor sperm. In this procedure, sperm from a healthy donor is used to fertilize the partner's egg through techniques like intrauterine insemination or in vitro fertilizations and IV FETs. Psychological support and counseling are also vital to help men and their partners cope with the emotional challenges associated with infertility. Currently, there are no known preventive measures for Sertoli cell-only syndrome, largely because the causes are often genetic or environmental exposures that are difficult to control. Avoiding exposure to known testicular toxins and maintaining a healthy lifestyle may potentially reduce the risk, but definitive preventive strategies are lacking. The prognosis for men with Sertoli cell-only syndrome regarding fertility is generally poor. Spontaneous sperm production and natural conception are highly unlikely. However, the overall health and lifespan of affected individuals are typically not affected. Recent research is exploring potential gene therapies or stem cell-based approaches to regenerate germ cells within the tests, but these are still in the early stages of development and not yet available for clinical use. Further research is needed to better understand the underlying causes of Sertoli cell-only syndrome and to develop more effective treatments to restore fertility. Thank you for joining us on this exploration of Sertoli cell-only syndrome.